Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. Tonight I'm talking about brain fog and autoimmune disorders, namely mast cell activation syndrome. I'm going to go through some other disorders as well, and I hope this is a benefit for you. Go ahead and pause the video now. Go ahead and read the disclaimer. None of this is medical advice, just for informational purposes only. Okay, so I've worked with a lot of patients who have brain fog as a primary complaint in my career. I worked with many, and evaluated, I would say, in the hundreds of patients who have chronic fatigue or fibromyalgia, and brain fog is a primary symptom, both of those disorders oftentimes. And I've seen a lot of improvements in brain fog through dietary measures and supplementation. It's actually pretty interesting how common brain fog is. And it's one of the primary reasons why I see a lot of individuals who just feel like their cognitive capacity is not there. They're having trouble thinking. Their thoughts are not as clear. Their focus is decreased, things of that nature, amidst many other complaints. The reason why brain fog is interesting, maybe again, relative to mast cells, is that as I've been talking about mast cell activation syndrome for a number of weeks, is that mast cells seem to spit out too much histamine and other inflammatory chemicals in about 1 in 5 people. And it seems that this issue may be even becoming more common with the current state of infectious diseases on the planet. And with that being said, when we started to learn about the profound impact mast cells can have not only on allergic symptoms, but also systemic symptoms, it became apparent that this is a big deal and we need to take it seriously. And that's what I'm doing. And as I discussed in other videos, I'm trying to learn with all of you because this is a relatively new topic. Now, mast cells, you can kind of think of it as a spectrum. On one end of the spectrum are conditions like systemic mastocytosis or cutaneous mastocytosis. These are, you would think of them more as like cancer type conditions, bone marrow type conditions involving the mast cells. And down here we have mast cell activation syndrome. Some people want to change the name, I think, to mast cell mediator disease. They don't like activation syndrome, but that always happens anytime there's a new phenomena that's being described. With that being said, those on this side who have like really severe hematological problems involving mast cells, their primary symptom, oftentimes reported, is brain fog. So it's very, very interesting that in this hematologic cancer type condition, that the primary symptom is brain fog more than other symptoms. And it's also been found that stress seems to be a major irritating factor for systemic mastocytosis and the urticaria, which is the rash that can be associated with it. There have even been studies done showing that hypnotherapy can dramatically improve systemic mastocytosis symptoms. So that indicates the profound effect that stress can have on these, what we used to just think as allergic immune cells. And now we're realizing they have tremendous impact on so many other symptoms. So that's interesting. What does it mean for the person with mast cell activation syndrome or mast cell mediator disease? I don't know because we don't have great research on that topic itself. We just know that those on the severe end of the spectrum, their primary complaint is brain fog, and they have way too many histamines and tryptase and things of that nature. So it's very plausible that those who are down here are more likely to have things like brain fog secondary to their mast cell function. One issue is that fibromyalgia patients, chronic fatigue patients are getting lumped in down here, and it's very well that a lot of fibromyalgia patients may in fact have mast cell activation syndrome, and I think that's a definite possibility. But anytime you start dealing with fibromyalgia-like presentations, a lot of patients are not going to be taken seriously by their doctors. And I'm already seeing that with mast cell activation syndrome, sadly. Doesn't mean all doctors, but I am seeing it more common than I wish I was. So I wish I wasn't seeing it at all, for the record. So just to kind of summarize common symptoms, really mast cell activation syndrome can cause a plethora of symptoms in many different systems in the body, from low blood pressure to passing out to fast heart rate, angioedema in the skin, pruritus, urticaria pigmentosa, gastrointestinal problems, abdominal pain, bloating, IBS type symptoms. Bone pain is a really common symptom of mast cell activation syndrome. Nasoocular symptoms, nasal congestion, pruritus, tearing. Neurological symptoms like headaches are really common with mast cell activation syndrome. Memory, concentration, brain fog, numbness and tingling, neuropathy, respiratory hoarseness or throat, wheezing, and then systemic anaphylaxis and fatigue. And the really confusing aspect of mast cell activation syndrome is that lots of times individuals may just have one or two of these symptoms, and what you'll see in their history is that things will start to stack on top of one another. They'll start to develop more symptoms through time. And with the current infectious disease process going on in our world right now, it seems like that may be an irritating factor as well. But because so many systems can be involved in mast cell activation syndrome, it causes not only doctors but patients to question how one issue can cause so many different symptoms in different people. Because we're so trained that, if you have a bone problem, you see the orthopedist, or if you have, a brain problem, you see the neurologist. What Dr. Lawrence Afrin argues is that if you can explain all of these phenomena, all these symptoms listed here, with one explanation, then we need to use that one explanation. Hence the reason why he references Occam's razor, which is a philosophical principle of logic. If you can explain all these phenomena with one explanation, then that's more likely than explain all of these phenomena with different explanations. So, you may have to wrap your head around it. I'm not saying that it's a perfect methodology yet with all of the MCAS data, but it's evolving and we're working on it. Okay, so we're going to hide that one. Another cause of brain fog can be non-celiac gluten sensitivity. So a lot of people have reactions to gluten. Gluten is in wheat, barley, oats, and rye. It's in most of the products that we're eating in our standard American diet. And frequently, the most common symptom patients report in studies is actually depression after eating gluten, not necessarily gastrointestinal symptoms, but depression. There can also be associated symptoms of brain fog, fatigue, joint and muscle pain. And I know certainly I have suffered with that when I've consumed gluten, that I get a lot of brain fog. There is overlap between non-celiac gluten sensitivity and Hashimoto's thyroiditis. That's where the immune system attacks the thyroid. The thyroid may still make thyroid hormone, and your thyroid blood tests will be normal. And most typically, the immune counts to the thyroid are not run. They're not performed by doctors, but this can be a big cause as to why people have brain fog. And in fact, there are a number of studies that have come out in the recent years indicating that the immune attack on the thyroid is far more important in terms of quality of life symptoms for thyroid patients than per se the hormones. There are many studies where they took individuals who are taking thyroid hormone and they looked at their titers of antibodies, which are like immune missiles to the thyroid, and they found that if people have this immune attack on the thyroid, their quality of life, particularly symptoms like brain fog, are very, very, very prominent. Yeah, and there's more, but I think that's enough on that point. Okay, this is a really nice depiction of how the immune system can cause brain fog. The more immune activation you have in the periphery, like when you're battling an infection, or if you have an autoimmune disease, that immune inflammation can break down your blood-brain barrier. The breakdown in the blood-brain barrier then facilitates inflammatory chemicals from your body going into your brain too easily, which can lead to basically other inflammatory cascades being turned on, which then creates inflammation in your brain, and that can facilitate brain fog. And then I think this is the last one. Yeah, this is just going over non-celiac gluten sensitivity and how it can be associated with so many diseases. Go ahead and pause this if you want to read it in more detail. So probably next week, I'm going to do a broadcast on testing for mast cell activation syndrome or mast cell mediator disease. I had a question on that this week, and I think it's a really poignant question that needs to be addressed. So I'm going to go through the lab tests that I run on patients who I suspect have mast cell activation syndrome. Fortunately, there's a lab here in my local town that does this really, really well. I've also seen other labs not do this so well. So I will go into that next week, and any other questions you have, send them to me. I would appreciate it. I hope you all have a wonderful weekend, and hello to everyone who's joined, and I will be back next week.